Hello friends, welcome to the channel Dewdear Academy. In this video, I have included the antimicrobial drugs contraindicated in pregnancy. Which are the antimicrobial drugs contraindicated in pregnancy? So there is a mnemonic to remember this antimicrobial drugs which are not to be allowed to use in pregnancy. That is, safe mums take really good care. Safe mums take really good care is an easy way or mnemonic to remember the drugs. So first, S indicates sulfonamides. S is sulfonamides. Then A is aminoglycosides. A is aminoglycosides. F is fluoroquinolones. Fluoroquinolones. Then E is erythromycin. Erythromycin. M is metronidazole. Then T is tetracycline. Then R indicates ribavirin. G is griseofulvin. And C is chloramphenicol. So this is sulfonamides, aminoglycosides, fluoroquinolones, erythromycin, metronidazole, tetracyclines, ribavirin, griseofulvin and chloramphenicol. Safe mums take really good care. Then about each drug, first one, sulfonamides. The side effect is it may cause neonatal jaundice and kernicterus. If these drugs are taken during pregnancy, there is chance for causing neonatal jaundice and kernicterus. Then the second category of drug, aminoglycosides like streptomycin, tobramycin and all. These drugs may cause ototoxicity and hearing loss. Aminoglycoside drugs like streptomycin and tobramycin may cause ototoxicity and hearing loss. Then the next category of drugs, fluoroquinolones, and that include the ciprofloxacin, norfloxacin, ofloxacin, levofloxacin. So these all drugs may cause arthropathy, joint pain and arthropathy. The next is erythromycin, that is mainly the erythromycin in the estolate form is causing these problems like congenital cardiovascular malformation in first trimester. Congenital cardiovascular malformations in first trimester is caused by the category of drugs erythromycin mainly in the estolate form. Then M is metronidazole, it is causing hepatic failure. Metronidazole is causing hepatic failure in babies. Then tetracyclines is causing tooth discoloration and bone deformities, and also it may cause liver failure. The tetracycline category of drugs may cause teeth discoloration, bone deformity and liver failure. Then ribavirin is causing birth defect and miscarriage. Ribavirin causes birth defects and miscarriage. Then another category, griseofulvin, that is also causing abortion, risk of spontaneous abortion. Then chloramphenicol is causing the problem, that is grey baby syndrome. It causes grey baby syndrome. Chloramphenicol causes grey baby syndrome. So what is grey baby syndrome? Grey baby syndrome means it is caused by the drug chloramphenicol. It is an antibiotic that is isolated from the bacterium Streptomyces venezuelae. Chloramphenicol is isolated from the bacterium Streptomyces venezuelae, and this grey baby syndrome is a condition in which the infant experiences a life-threatening reaction that is more prevalent in premature infants, and the adverse reaction is directly related to the liver's ability to break down and process the medication. So this grey baby syndrome is caused by the drug chloramphenicol, an antibiotic that is isolated from the bacterium Streptomyces venezuelae. And gray baby syndrome is causing a life-threatening reaction, and it is more common in premature infants because it is an adverse reaction that is directly related to the liver's ability to break down and process the medication. So these infants with gray baby syndrome experience a sudden drop in the blood pressure, and also the skin and nails of the babies will turn grey color from the lack of oxygen, and the lids turn blue. So that is grey baby syndrome. So these are the drugs. So these are the antimicrobial drugs that are contraindicated in pregnancy, and the mnemonic is safe mums take really good care. So thank you for watching this video, and share this video to your friends.